Welcome to Understanding Grief, an educational presentation by the Bereavement Counselors of Hospice East Bay. I'm Dawn Torre,
And I'm Julia Aronowitz.
and we're glad you're here. The purpose of this presentation is to offer you a basic understanding of how grief impacts us on an emotional, physical, mental, and spiritual level. We will also look at how social isolation brought on by the 3 years of the COVID pandemic may also be affecting your grief experience as well. Other things to consider during this presentation are grief, mourning, and bereavement, grief triggers, how grief affects us, how to cope with grief, and how to support others on their grief journey. At the conclusion of this presentation, it is our hope that you will have a greater understanding of the role grief is playing in your life and how to navigate feelings of grief and loss and how to support others in their grief journey. We often think of grief as described as being or coming in waves in the ocean. They're unpredictable, they're powerful, and they're ever changing. It is crucial that we not resist the tides that the ocean brings, but instead give in to them and trust that after each wave, we will be brought safely back to shore. We tend to lean into the waves in order to get a better footing and a balance in the ocean. Our society seems unprepared for death. Our culture is a death-phobic and grief-illiterate society. We are scared to death of death, so we ignore it. The most wondrous thing in the world is that all around us, people are dying, yet don't believe it can happen to us. As both of these quotes suggest, death is not something that we as a culture spend much time thinking or talking about until someone we love is dealing with a life-limiting illness, dies, or when we ourselves are faced with our own mortality. Over our lifetimes, we've been conditioned to value positive emotions like happiness over the negative ones like sadness. In addition, as a society, we seem to place a higher value on quick fixes rather than the time it takes to understand what is causing the physical and/or emotional pain. We're taught to downplay the need to express emotions, and the message that those who are actively processing the death of a loved one is that grief is a condition that the griever is encouraged to take control over their feelings and can only happen on certain occasions, and that the duration needs to be brief. And we're not allowed to wallow in our grief. This messaging often leaves many bereaved believing that they are experiencing their grief journey incorrectly, that somehow they're doing it wrong. In reality, nothing can be further from the truth. Grief isn't a dirty word. Someone who is experiencing emotional and physical reactions to the death of a loved one isn't broken. Grief is an extension of love that we have for the person who has died. It is an expected outcome of being human. So, what is grief? Grief is a natural consequence of a loss. It is a healthy response to the death of someone important to you. Grief is an internal expression of the bond you have to the person who died. Grief is an inevitable part of living. Each person's experience of grief and loss is unique. Grief is universal, however, there is no universal grief, and there is no right or wrong way to grieve. Mourning. So, what is mourning? Mourning is what we do to show or express our grief. It is what we do to demonstrate externally what we are experiencing internally. Traditional rituals such as funerals, prayer, crying, visiting the gravesite, or lighting candles are all expressions of mourning. What is bereavement? The dictionary describes bereave as the experience of being deprived. It is the period of time after someone important to us dies. So it makes some sense that if we're feeling the pain of bereavement and of grief, that we are feeling deprived of the person that we lost. What situations other than death might cause a grief response? Well, losing or leaving a job, moving, the death of a pet, the ending of a relationship, a breakup, or a divorce, developing a chronic or life-limiting illness, children leaving home, going off to college, getting married, or getting married yourself and having a baby. It isn't just the quote-unquote negative life events that we have and that we experience. Also, the positive ones that involve a lot of change might evoke a grief response as well.
So far, we've reviewed the concept that grief is destabilizing. Our society does not talk about grief or prepare us for what to expect. The ways we respond to grief are informed by our culture, family norms, religious frame, if we have one, as well as our own personal emotional makeup. With that in mind, these are a number of common grief reactions: shock, numbness, fatigue, sleep disruption, lack or increased appetite, restlessness, irritability, increased sensitivity, deep sadness or emptiness, heartache, and what we call grief attacks. There is no right or wrong way to grieve. These are some common responses, but anything else or different that you might be feeling is just a part of your own personal process. Some common ones include anger, guilt, regret, relief, fear, anxiety, depression, suicidal feelings, isolation from others and withdrawing, disorientation or forgetfulness, fogginess, what we call a grief fog, needing to be around people who understand, staying busy, talking to the deceased, and questioning our belief system. Unexpected or traumatic loss, such as death by suicide or a violent act, has its own particular range of emotional responses that go beyond what is commonly experienced by individuals who are grieving the loss of a loved one after a long and protracted illness. Being unable to say goodbye, witnessing a violent death, shame, or self-blame, such as in suicide, are all situations that can contribute to an individual experiencing traumatic grief. Traumatic grief can be painful because of the disturbing way a person was lost. The circumstances of the death add trauma to an already challenging grief process. These include intensified shock, stun, numbness, insomnia, nightmares, hypervigilance or fear, strong feelings of personal responsibility, a sense that the world as one understood it has been shattered, public intrusion into a private loss, and survival guilt. Dawn, I'm going to pass it back to you.
Thank you. And what makes each person's grief unique? Well, who you are, your personality, how you view and cope with the lack of control over painful events, a lot of things. Your culture, religion, and personal beliefs, who the person was that died, your relationship with that person and the length of the relationship, the timing and circumstances of the death, how you have grieved other losses in the past, your own personal coping skills, and the extent of your personal support system. How long will I feel this way? Well, grief is a lifelong process. It isn't linear. It does not follow stages. It takes longer than anyone thinks, and each person adjusts to their own new normal at different times, and you cannot rush through or hide from your grief. So, to sum it all up, grief is truly a process. It's not a solid single state. So, there are myths about grief. Societal and cultural discomfort with death and grief will frequently make individuals feel as if they are expressing feelings of loss somehow incorrectly, or that they're defective in some way because they are still grieving, quote unquote, still grieving. Well-intentioned family members and friends may make statements meant to be supportive of the grieving individual. However, it comes across as sounding judgmental and inadvertently minimizing of the bereaved's feelings. Some of the myths about grief are: a person should be over their grief in a prescribed period of time, weeks, months, years, etc. Grief declines in a steadily decreasing fashion. Grief eventually ends. All losses are the same. People all grieve the same. We only grieve deaths. The intensity of grief expressed indicates how much you love the person. Grief affects only our emotions. A grieving person should always be left alone, and one must talk about grief in order to express it. There are many psychotherapeutic models about grief. However, they all say mostly the same thing. William Worden's model describes this process in very, very simple terms. And simple, but not easy. One, accept the reality of the loss, experience the pain of grief, adjust to a new normal, and reinvest energy in the life that you have now. These stages are not meant to be linear in any way. All grievers will experience these tasks at different times, so it is unfair to compare your journey with that of another grieving individual. And Julie?
Thank you. As you are doing now, continue to obtain information about the grief process. Remember, grief is like wading into an ocean. Lean into the experience and find your own balance. Find ways to express your feelings of grief that speak to you. Reach for support, but be mindful of those around you are able to meet your needs or are not in ways that you want and need. You might consider making a list of people in your support system, writing down how they support you. Some may be good at making you laugh or just listening unconditionally, not giving advice or commenting. Others might be able to make a homemade meal that makes you feel supported that way. Um, Reach out to the person who feels right to meet your needs in that moment, and don't get hung up on the expectation that certain people should support you in certain ways. Some you might expect to be helpful in some ways might turn out, unfortunately, not to be the right person for that moment at all. Others may surprise you in being more supportive or more non-judgmental, or who might have their own experiences that enable them to really meet you and be present in ways that you might not have expected. If you find that your support system is lacking, seek out support from a counselor or a support group. Sometimes, when we need support the most, we tend to be reluctant to reach out to those we love and trust. Perhaps it has something to do with the fear of being seen as weak or incapable of caring for ourselves. Don't be afraid to ask for help. It isn't a sign of weakness. It's simply an acknowledgement that you are human. And in fact, reaching out for support is truly a sign of being strong enough to be vulnerable in an important moment. Give yourself permission not to have all the answers, and be present with what you're experiencing, both emotionally and physically, as we hold a lot in our bodies. Find your own balance between finding the time you need to grieve and focus on the loss, and time away from it, focusing on self-restoration, healing your mind, body, spirit, maybe even just distracting yourself in small doses. Sometimes a little TV is just what we need. Honor your loved one with a meaningful act, if that feels resonant for you. Planting a tree in their name, creating a special memorial space in your home, volunteering for a cause that they cared about and loved. You can share your grief journey with others in similar circumstances. People who get what you are experiencing and place no expectations or judgments on how you express or move through your journey, like in a support group, or if you find people who are in a similar place in your own life. Focus on coping mechanisms that have been useful during the past challenging times you've experienced, and try to integrate those again. Be on the lookout for your own internal critic, the one that says you should be doing this or should be doing that. I should be coping better, or I should be focusing on important stuff and not having my feelings, or maybe I should be feeling more or crying more. Be present with what is, not what story you have about what should be. There are some coping strategies that are less supportive than others. We can't be focused on our grief 24/7. We need space to check out or have things sometimes feel a little less heavy. But if you find that you are avoiding your grief altogether, you can remember the saying, the only way out is through. Avoiding our feelings often means that they will end up leaking out later when we least expect it. So if your instinct is to avoid, whether by overworking or just keeping yourself very busy in other ways, find small, contained ways to engage your grief. Have a ritual of morning coffee with your loved one using a mug they gave you or that you associate with them. Go sit outside for 5 minutes in the yard before dinner, and then move your body a little before you come back inside to transition. Or do some journaling and make a ritual of putting the journal away when you're done. If you find that you're ruminating or isolating, try to engage in daily practices to interrupt those practices. Get up and go to the bathroom, go take a walk, have a regular weekly plan with a friend, even if it involves planning something that doesn't require talking. For rumination, you can picture putting those thoughts that keep circling in a box and closing it tightly. Add more as needed. Some people like writing those things down so they have a contained place to go that's not just sitting there on your shoulders weighing you down, but are actually being held somewhere else. Every person's journey is different. However, there may come times where one feels like they may need additional support. Like with alcohol and drug use, engaging in risky behaviors may serve as a short-term distraction, but doesn't really help address the root cause and ultimately present their own additional challenges and concerns. Don't hesitate to reach out to your doctor or for other forms of support. Grief can become so pervasive that sometimes when one is looking to engage in new activities, we don't create space to be present with what is. And feelings of depression sometimes may extend beyond the loss of a loved one and feel all encompassing. Don't hesitate to reach out for support and know that it's not because you're doing anything wrong, but because sometimes getting support is the right way to help take the step to get what you need to move forward with your grief, not instead or away, but together. Don, back to you.
Thank you, Julie. So, companioning someone who is grieving. Henry Nguyen wrote, "The friend who can be silent with us in a moment of confusion or despair, who can stay with us in an hour of grief and bereavement, who can tolerate not knowing, not healing, not curing, that is a friend indeed." That being said, it is so intuitive of us to want to help, and of course to care, and to try not to fix. It is our job as somebody who's companioning to not necessarily fix, but certainly to listen. So, what can you do? Well, supporting them in their journey by validating exactly where they are at that moment, exactly where they are. For example, statements like, "I love you and I care for you very much. Would you like help with say, a specific problem, or would you just like an ear and a shoulder?" So, giving them agency and allowing them to choose also how they're grieving and what they would like to talk about can be very empowering when you're feeling so much pain within your grief. So basically, listen, be in the moment with that person, allow them to express their feelings without judgment, and do not impose your own experience, and be patient with silence. Reflect back what you have heard them say. For example, what I heard you say is that you are feeling X, Y, and Z. Is that right? Be an active listener. This means responding back to the person in a way that shows empathy. An example would be, "That must be very hard," or "That sounds very sad." Be patient with the person's process. The time they need is different than yours. And that's really hard for us sometimes to remember because we want them to be that exact same person that we've always known, but they're not exactly the same anymore. Talk about the person who died. Most people who are grieving just want to talk about their loved one and share memories about the ones that you have with their loved one. It really is an important part of the process. And if you can, don't ask, just do. So instead of asking them to call if they need anything, pay attention to what they may need, like the lawn mowed or groceries or preparing food or having the dog walked or bathed, etc. So just show up and do it. Chances are they will go ahead. If you can give them a yes or no question, they'll say, "Hey, has it been a long time since your dog's been washed?" And they'll say yes. And they say, "Can I come over and wash the dog for you?" Those yes or no questions are a lot easier to answer than "How can I help you?" The grieving person may not have the capacity at the moment to be able to explain what they need. And don't take it personally. When someone is grieving, their emotions are raw. Have appropriate expectations of the person who is grieving. A person who's experiencing grief has had a life altering event happen, and they are in a state of confusion and disequilibrium. Remember, the grieving person is not the same person as they were before the death. They are different and may act differently. This is normal. Give them time to figure out who they are without their loved one and without passing judgment. Keep checking in, even if you believe they are doing okay. Most people over time put on the "I'm okay" mask because the message they receive from the outside world is it's time to stop grieving and to move on. Just normalizing the fact that they are not feeling okay can be a huge burden lifted off their shoulders. And they are doing okay, even if they're not okay. What not to say? Um, Even the best of intentions by the best intended people may end up coming out or hitting the grieving person wrong. Some of those things that we try not to say are, "It was God's will." You are lucky you had them for as long as you did. She is in a better place. You can always have more children. Um, I have a friend who had that same experience. Um, I know how you feel. Or, "It's been 5 months. Isn't it time to move on now?" And focus on your thoughts and the good times you had together. Avoid unintentionally guilting the bereaved into feeling better, and avoid comments like, "Don't be sad, think of all the happy times you had," or, "Your loved one would want you to move on with your life, so let's just think about what they would want for you." This can be a bit challenging as we don't want to see the ones we love suffer, but these sorts of statements, while well-intentioned, may actually cause more harm than good and leave someone feeling as if their process is wrong. So Washington Irving says it so well in this quote of his: "There is a sacredness in tears. They are not the mark of weakness, but of power. They speak more eloquently than 10,000 tongues. They are the messengers of overwhelming grief and unspeakable love." If I've learned anything about supporting grieving people through their grief journeys, it's that we are far more resilient than we can possibly imagine, and that grief is more painful than we could possibly know. There is no single right way to grieve. There can never be a one size fits all approach to this experience because we're human and we are far too diverse in our beliefs, values, and traditions that we can, simply ask for a quick fix answer. The simple truth is that we grieve because we love. So rather than thinking of grief as a necessary evil that we must endure, although sometimes it is, for the price of loving another, maybe we can reframe grief as an extension of the love we have for the person who died. And while again, grief is messy and disorganized and painful, it may also give us a greater ability later to tune in with others who are suffering through their own personal pain as well. This concludes our presentation, Understanding Grief. If you would like more information about grief or the services we provide grieving people in our community, please contact us. We would be happy to help in any way that we can. So, on behalf of Julie and myself, thank you for viewing this presentation on understanding grief. Take good care.